Have you had a tooth removed and have some health issues that just don't seem to resolve no matter what you do? Well, if this sounds like you, then this is your episode. Today, we are going to deep dive into cavitations, which are also known as ischemic bone disease or altered healing. So stay tuned. Welcome everyone back to an episode of Your Mouth Matters. My name is Dr. Rebecca Taylor. I am a biological dentist and the owner of Green City Dental, a biologic holistic dental office, and O2donics, a practice focused on TMJ, snoring and sleep apnea, and functional orthodontics. We are located in Edmonds, Washington State. Welcome everyone. I want to introduce our guest today, who is somebody I work very, very closely with at Green City Dental. This is Dr. Isabel Perez. Good morning. How are you?
Good morning. I'm great. Thank you.
Yay. I'm so happy because I am, this topic that we're going to talk about today is something that is, a lot of patients call about it, but a lot of patients just don't know about it. And so, we see a lot of it on x-rays. We see a lot of radiology reports that come back that show us that there could be something going on. And it's just a lot of people, like I said, traditional dentistry doesn't really talk about cavitations. And I know we're not supposed to call them cavitations, but it's in my brain that they're called cavitations, Dr. Isabel. So I'm sorry. I'll do my best just to stick to ischemic bone disease. But anyways, for anybody listening, you probably, if you hear the word cavitations, you probably are thinking about a cavity on a tooth. But this is actually not a cavity. We're not actually talking about teeth when we talk about cavitations or ischemic bone disease. This is actually an infection that's in the bone, in the jawbone. And typically these happen after you have a tooth that is removed and there's not a lot of blood flow to that area. So I am definitely not the expert in this area. I am not the surgeon in the practice. This is Dr. Isabel. So Dr. Isabel, can you just kind of explain to us what are cavitations / ischemic bone disease / altered healing? We see that a lot on radiology reports.
Yes. Well, the cavitation or the altered bone healing, that's and the more proper term is ischemic bone disease. There are multiple other names because this has started coming to the surface in early 1900s because they were finding holes in the bone when they were doing some surgeries or some procedures where there was supposed to be intact solid bone and there wasn't. So then people started thinking, okay, what's going on? What's happening in this area? And why is it that 10 years ago, this patient had an extraction, for example, and is still not completely healed? Healthy bone is not supposed to be mushy or having there are some cysts of oil. When you go and clean that area, there is oil coming out. There is just really soft tissue. Granuloma is just bad infected tissue. So how can you have an area like that after 10 years of healing, supposedly? So then it is a local reaction to a systemic or a local factor that reduces the nutrition of that blood or of the bone in there, and it causes a reduction of the blood supply. So then it creates an island where there is no blood supply, where there is no life in there, so the bone dies. When we go in that area, we see that the bone is necrotic, is dead, is not vital, is like crispy, and is not hard the way it's supposed to be. And then the thing is that they have done pathology on those cases, and they have found a significant amount of inflammatory factors in these areas. Unfortunately, these cavitations, a lot of the times are not symptomatic. I will say maybe 90% of the times are not symptomatic, apparently. But there are subtle things that the patient has, or subtle symptoms that the patient has that are not associated with the mouth. For example, we had a patient that was consistent high blood pressure, 150/90, consistent. And he had a cavitation area. When we did the surgery, this patient, overnight after surgery, his blood pressure started to be normal. lower blood pressure, and never had that high blood pressure again. So it was a little symptom, a little sign that there was something going on in the body, but he didn't kind of put the two pieces together or the two dots together. But this is one of the examples. A lot of patients have, for example, anxiety, or they can have skin rash that is not going away, is not improving. And then what we are seeing is that patients that have cavitations or altered healing and ischemic bone disease, there is an increase, 30 times increase of inflammatory factors in the body. So if your body is trying to fight and trying to heal this area of infected tissue, is taking away from other functions that are more important and is lowering the immune system.
I think also, so a lot of times we see cavitations in third molar wisdom teeth sites. It's kind of become like coming of age, like practice where, oh, you turn 17, it's time for your wisdom teeth to come out. And, when we take those wisdom teeth out, like I said, almost everybody's got their wisdom teeth out. So a lot of times we see these areas of altered healing in the wisdom teeth area. And it's interesting that you brought up the blood pressure because the wisdom teeth are on the heart meridian. And I've heard this a lot with patients who, like, when they go ahead and get those cavitations cleared out and they remove that infection, that tissue, that oil, all of that granulation tissue that you were talking about, and then they heal and they have solid bone, they have healthy solid bone, a lot of them see improvements in their cardiovascular health because of that connection to the heart meridian. I think it's just fascinating. And, it's hard because as a dentist, we cannot claim to be treating the systemic body, right? Like we know that there's connections, but I can't say, hey, if you do this, then your blood pressure is going to get better, right? That would be me practicing medicine, which is completely out of the scope of dentistry. So want to make it very clear to everyone, we are not over here saying, hey, do your cavitations and all your health problems are going to go away. However, we have to remember that we are one body, right? And so like you said, when there is a lot of inflammation in the body and your immune system is focusing so much on taking care of that, and there's again, when you have an area that's necrotic, there's no blood flow, there's no immune system that can get into that area, there's no oxygen. So things go there to hide in our bodies. We see all sorts of nasty, nasty microbes that live in these areas where the immune system just really can't get in there because there's no blood supply. And then when you look at the location of the third molars or the wisdom teeth or even the mouth, anywhere in the mouth, it's just a couple of inches away from the brain. And there's a ton of lymphatic drainage that happens in the neck. If you look at a poster that has all the lymph nodes and the drainage pathways, they all we're draining down through our neck and all of that's just getting into that lymph system. And that could potentially be causing issues. And then if you take a patient who's got issues with lymphatic drainage or issues with proper circulation, then that also plays a big role. So I think it's, like Dr. Isabel was saying, you may not have symptoms. Some people do. They have issues where they get blood work done and they just can't figure out why this is high, or I have high blood pressure. I don't really know why. So if you have health issues that you just can't really figure out the why, then you really owe it to yourself to kind of look into seeing if you might have a cavitation or some altered healing where you had teeth removed. And a lot of the times, like I said, we see them in third molar sites because if you have a tooth removed in the front, typically you're going to go back in and place an implant. So if there is any of that happening, usually that would be removed when you go in to put an implant in. But in the back molars, the very, very back molars, we're never really going back into those sites. I mean, the surgeons are like, pop these things out, bye, we're never going to go back there again. We're never going to look back there. So they just kind of go unseen. And for a lot of people, they become these chronic infections, which don't have any symptoms because, no symptoms locally, right? You're not like, oh, my jaw hurts so bad. There's really no nerves in the bone. So there's really not a great way for our body to tell us that there's something going on.
And then the interesting thing is that ischemic bone disease doesn't only happen in the jaw. There's also cases of hip and knee ischemic bone disease. And they talk about 1/3 of the hip replacements develop ischemic bone disease.
Wow.
So it is interesting that cavitations, ischemic bone disease, alter healing in the jaw is the third most common bone disease after arthritis and osteoarthritis.
Wow. And it's crazy because most people don't even know what that is, right?
Mm-hmm, exactly. And then also they find that there is a lot of the inflammatory cells in the body. And the main inflammatory cells that show up are the cytokines. And these cytokines are a protein that are responsible for every disease of chronic inflammation. So if we have an increase of these cytokines in these areas, why are we not treating that? The majority of the cases, or every single case, will be sent to pathology because we want to know what it is that's happening in there. And the majority of them, the cases are like up to 9. It's considered normal or stable. But then if you have a greater amount of 9 of bacteria in these areas, that's considered a severe risk. Majority of these cases are coming with really aggressive bacteria. And the body is trying to fight these aggressive bacteria. When we take a slide of the blood and the tissue that comes out of there, there is a lot of white blood cells. White blood cells are the army of the body. So they are there because they're trying to fight these aggressive bacteria. Our body, the immune system, is being depleted by attacking these areas of inflammatory tissue. So we need to be treating that. If we are we're not just treating holes in the teeth. We need to be an oral physician. We need to treat everything that can be affecting the rest of the body.
Yeah, I mean, preach. Amen. I think that, yes, as dentists, we become such tooth mechanics and we don't really look at the jaw. Like I said, we just take the teeth out and then we don't really go back into those areas again. So, I think a lot of times I get this question from patients. They're like, well, what causes these? And I think that there are so many different things that can cause and trigger a cavitation to start. And sometimes even patients will have cavitations cleaned out and then they might even come back, right? So it's really important. I think a lot of times people jump into cavitation surgery and I think it's a little too premature. So the way that we treat cavitations, like if you come in and we'll do a CT scan, we will look at the bone density in areas and, take a medical history. And then we'll decide if this is something that needs treatment or not. So if it does need treatment, there's some different ways, right? So maybe Isabel, you can talk about the different treatment options for patients.
So before talking about treatments, I wanted to talk about the triggers that can be causing this ischemic bone disease. Because when you know the triggers, then you can start also preventing this type of conditions. And then unfortunately, yes, if there is an infection or if there's trauma and you have to have a tooth removed, that's one of them. So having extractions and not having them cleaned properly, because that's one of the things that we do at the office is that we make sure that we're removing all this periodontal ligament, that tissue that surrounds the roots. We're removing the infection. We use laser. We use ozone. We use a piezo device that cleans and just removes all this infected tissue or this ligament that can be telling the body, okay, there is still a little bit of tissue in here. Let's just don't cover it completely with bone because there is going to be a tooth. So it's kind of giving information to the body that is not accurate, and it creates these holes, this alter healing in the bone. So just if you had an extraction, it will be a really good idea to have a CT scan and have that checked to make sure that you're not having these islands of no bone in the jaw. The other thing is titanium implants, and actually in general, metal in the mouth can be causing interference in the healing and causing inflammation in the mouth. So when we have a low blood circulation on that area, or when there is no blood supply, that nutrient that the bone needs, there is going to be an island of no bone or an island of alter healing that we need to start looking into it. So if you have implants that are titanium especially, you should have those checked as well. Just make sure that there is no island of no bone around them. a lot of the times they talk about how estrogen therapy can be causing some low blood supply in the area. Some corticosteroids therapy, anemia. Nutrition is a big part of it. If we're not having good nutrition, trauma, like when we talk about maybe clenching, grinding, if it's excessive part of function, if it's excessive trauma in the jaw, then we can cause some reduction of the blood supply. And there are so many other things that need to be addressed. And we want to prevent. We don't want to treat. I do love surgery. I love removing all these infections. But if we can prevent this, if we can help the body have the right nutrition, have the right tools, the right supplements to be able to heal properly after an extraction, for example, why not do that instead of doing it wrong and then having the consequences down the road?
Yeah. I mean, at Green State Dental, if you come in and you need a tooth out, we're not like scheduling you the next day to get your tooth out. Like there's actually a very specific protocol we have to make sure that you're following. We have to make sure your vitamin D levels are good because studies show that lower vitamin D affects the ability for your body to heal after an extraction and to build healthy bone. You know, your body has to have those building blocks. You've got to have the minerals. You've got to have the fat-soluble vitamins that are going to encourage that proper bone formation and the mineralization of that new bone that's coming in, and filling in that hole, whether that's a tooth extraction or removing a tooth that has a root canal or taking out infected bone areas from a cavitation site and then, and then healing, right? We want to set that body up so that it heals. And I think that this is something that so many people, like when I had my wisdom teeth out, I got put out. I don't even know what happened, right? I was out for 15 minutes. He like popped them all out. I bit on gauze and then out the door I go. That's what we learn in dental school too. Like you take the tooth out, you might scrape a little bit down there and try to get some of that tissue out, but then you have them bite on a gauze and off they go. And the issue is that if you're leaving infection in that bone doesn't have like surface to really rebuild and grow and heal properly. And so, you had mentioned like the periodontal ligament, like that ligament tells the body that there's still a tooth in the head. So if you don't remove that ligament, then the body's never going to get the stimulus to say, hey, there's no tooth here, we need to heal, right? So it's really important that the dentist that's treating and doing the surgery is doing and using the proper techniques. But it's also important that the patient is ready for that surgery and that we're setting the patient up so that they can have the best healing. Because we don't want these to come back. They can come back, and we have had several patients that have had cavitations done at other places. And, 5 years later, they feel, oh, something's still there. You do an x-ray, it's not better. So we have to make sure that we set them up. And sometimes, we have to slow down. We have to slow down and make sure that all of the other stars are aligned before we go in and we treat, because nobody really wants to go in and have a surgery again, right? And that's usually what we do to treat these.
Mm-hmm. Correct. Another thing that is important for people to know, and if this is the only thing that you get from this podcast, is when you're having any type of dental procedure, maybe ask your dentist to not use any epinephrine on your anesthetic. Because when you use epinephrine, it's a vasoconstrictor. It constricts the blood vessels. So what is happening if you have a 2-3 hour procedure and you're being numb, you're numb for that time, you're reducing that blood flow in the area for that amount of time. So that's one of the things that I'm doing. And when I started learning about the triggers for the ischemic bone disease, I decided, okay, I'm not going to be using any epinephrine unless it's strictly necessary in a very low amount and not in an area that can be causing this problem. So there is many options for anesthetic that work without having that reduction of the blood flow. The other thing that is important to understand is that when you have metals in the mouth, for example, if you have a gold crown and next to it there is an amalgam, there is a reaction in these metals that is causing inflammation in the body, that is causing an immune system reaction and is affecting the blood supply as well. It can be affecting it. So just make sure if you have an amalgam or a silver filling and you have a gold crown next to it, it might be a good idea to start thinking about first replacing that, and then second, checking and making sure you're not having any of this altered healing or ischemic bone disease. Then when we're talking about treatment, when we go and talk about treatment, there's different options depending on first the location of the area, and then also the size, and then the symptoms. So there's definitely a report that we get from the radiologist confirming that there is an altered healing area. And then we will just talk to the patient, and it will be a good idea to, if the patients have a naturopath or a physician that can do muscle testing, that's an option, and electromagnetic frequency and measuring the density actually of the area, see how dense the bone is. And there's ways to determine how dense the bone is, and if it is actually an altered healing. But then, so we could do aspiration of the area with the needle and remove the infected tissue if it's a small amount. Then we can use some ozone, inject some ozone in there. We're changing the chemistry of this infection. And then we're allowing the body to do the job, which is take care of it and heal the area. But we talked about the nutrition and how important it is. And if you're doing the right things, if you're boosting the immune system, then the body on these small areas can heal that itself. But then we need to provide it the right tools. As you mentioned, the drainage, lymphatic drainage is a really good idea. And everybody should be doing some lymphatic drainage. And there's ways to do it yourself. Mm-hmm. So it's not necessarily you have to go to someone and pay extra money to do that. You can learn to do that. And there's videos on YouTube. And
we, by the way, we have protocols for patients that are, prepping your body for cavitations, and then during and then after, post-care, like what we recommend. So if you come to Green City Dental and we decide that you have cavitations or altered healing, and we recommend replacing or doing something about it, then we would definitely, make sure that you're on our protocols. But if you're going to somewhere else and getting cavitations done, you just want to make sure that whoever you're seeing is going to also have those pre and post protocols, so that sets you up for optimal healing.
Because what we want ultimately is to have the body go back to its natural way, go back to a healthy bone, good flow, good nutrition. And then also we need to make sure that a lot of times we need to use antibiotics, because all this really aggressive bacteria is going to cause problems, and we need help from antibiotics. There's also, like, when the areas are really big, we need to go in there and surgically remove this infected tissue. And with every single case, we will remove the infected tissue. We'll clean it with the piezo. We'll clean it with laser, and we use ozone. And then at the end, we'll use PRF, which is the plasma-rich fibrin, which is the building blocks of your own body. Your body is going to accept that right away because it's coming from you, and is going to help with the healing. Another thing that we recommend is laser therapy. And we do that after every surgery, that we use the laser to stimulate the healing and the circulation as well. Another really good idea would be to go to a hyperbaric chamber and just reestablish that blood circulation. Just be able to make sure that the body is ready for the healing.
Yeah, so much of this feels like, fluids in the body need to be moving, right? Mm-hmm. Because part of the reason why this happened in the first place is that there was stagnation, and there's not enough blood flow. And that's where, the anesthetics that we're using that have epinephrine, that's going to cut the blood flow off. Clenching and grinding, that's going to cut the blood flow off. If you're anemic, that's going to change, the blood and the amount of oxygen that your tissues are getting. So this is really about getting oxygen into the tissues and getting the immune system there so that we can heal, right? Mm-hmm. And so, and it's always crazy to me because we look back and, how many dentists are using anesthetics with epinephrine? I mean,
everyone.
Every single dentist
Yes.
I know is using anesthetics with epinephrine. And it's just like, we don't even know what that's doing, and it does make our job easier. I mean, the reason why we use anesthetics epinephrine is because it lasts longer. And if you have a patient that's really hard to get numb, then you need more of it. And it actually will turn the tissue white. If you use enough of it, it'll turn the tissue white and blanch the tissue so that you don't get bleeding, which is great when we're doing fillings and all that. But, at what consequence is that? What's that doing to the tissue? So it's just fascinating. I feel like more and more dentists are becoming aware of these altered healing areas, and we're becoming a little bit more conscious. I think that's starting to, we are seeing more and more dentists. Like I'm seeing biological dentists popping up all over. It's really exciting to see. And I think that, cavitations are one of those things, again, that's a little bit more specialty, right? Like we never talked about them in dental school. We never talked about treating them. You really have to go through a lot more extensive training to learn about how to do cavitations right and how to set the body up. And, sometimes there's things like if you have a bunch of metal in your mouth, you might want to remove that first before doing cavitations. Or if you are a patient that clenches and grinds a lot, or you have sleep apnea, we may want to make you an orthotic to help level out that bite and give your nervous system a little bit of a break and just increase that lymphatic drainage and flow. Chiropractic can also be very, very helpful in getting everything moving, right? So we want to set the environment up right and then do the treatment and then hopefully have really great healing in the end. So
we invite you to go and take a look at your past experiences, like extractions, root canals, implants, or past treatments, I should say, and maybe go and follow up. Maybe there is something going on in there. And if you're having something systemically, or if you are a patient with an immune disease, let's go and research a little bit more about what's going on in your mouth that is not giving you any symptoms, but can be influencing your immune system and your systemic health. So just go a little bit deeper, do a little more exploration. Information, data is really critical. When we don't know what we don't know, we cannot do anything about it. So we need to discover, okay, is my healing area okay? Is my area where after I remove the tooth is okay? Is this root canal okay? Is this implant okay? So just check, make sure that everything is stable and is not causing any problems to your body, and then make your decisions.
Yeah, I would say, a lot of patients have their cavitations treated and they have amazing changes to their health. I mean, I've seen several patients, like you said, the guy that had the blood pressure issues. I've had patients that have had chronic urinary tract infections clear up after taking out these infections. The stories can go on and on and on. And especially if you talk to dentists and you get into a group of dentists that do these cavitations, I mean, the stories can be like amazing. But there's also a group of people that do cavitation surgery and they don't get these miraculous health improvements. So I think it's really important. Again, we're dentists, and what we're doing is we're looking at our CT scan, we're looking at the risk factors, we're looking at the density of the bone, we're going over health history, and we're going, is this something that we think needs to be addressed? And just like everything else in healthcare, nothing is 100%. And so it's important that patients understand that. And I also think that a lot of dentists jump into treating cavitations prematurely before patients are ready. And so what happens is they don't get the most optimal outcome. So like I said, if you are thinking in your head, oh my gosh, this sounds like me, I've been working with a functional medicine doctor, I've got inflammation, or I just can't figure out some other health issues that's going on. Or
digestive issues are big ones.
Yeah, digestion. I mean, any health condition. I mean, it's anything. I mean, we are one body, right? And the places where our body breaks down are kind of our weak points, right? And sometimes that manifests in the gut, and sometimes that manifests in the arm, and sometimes that manifests in the joints. And, you don't know exactly where there's going to be manifestation in your body. But if you have issues that are unresolved, then you kind of owe it to yourself to come in and have a CT scan taken so that we can really thoroughly diagnose. And we 100% of the time are sending our CT scans off to a radiologist because I want to have an unbiased opinion, right? So many patients come in and they come in and say, oh, this dentist told me I need all of these cavitations done. And, we look at the x-rays and we're like, really? You think so? And, we send it off to the radiologist and they're like, yeah, maybe this one area, right? So if you're not getting that second opinion from a radiologist who's very trained in reading x-rays, then I really am cautious about those treatment plans because I do think that some dentists in the biological world, and I won't mention any names, but I do think that sometimes there's overtreatment, and we definitely, that gives cavitation surgery or, altered healing surgery like a bad name, right? And so we want to make sure that we have reason to go in and do a surgery. We want to make sure that we are not just, cutting everybody open that walks in the door, the next day. We want to make sure that we're laying the foundations and we're setting you up so that you have more, better healing long term. So I think that's what makes Green City Dental unique. I think, there's lots of other great dentists that are doing this the right way. But as a patient, you have to be your own advocate, and you ultimately, at the end of the day, have to decide what's right for your body. And so if you are listening to this and you're feeling like, man, I feel like there might be something going on, then give us a call. Like Dr. Isabel is happy to even do virtual consultations. If you are across the country and you want an opinion about something, she's happy to do virtual consultations. She would prefer that she see you in person. But we are here to help. We're here to guide you through this process. And, happy to reach out to your physicians that you're working with. A lot of naturopaths and functional medicine doctors don't know about cavitations. They have no idea the impact that it can have on the systemic body. And so this really can be a great adjunct treatment. And again, everything that we do is from that integrative model. We are one piece of the puzzle, and our goal is to help you as the patient achieve better health and help put those pieces of your health back together and work as a team with your other healthcare practitioners. Thanks everyone for joining us today. And like I said, if you have any questions or you want to set up a consultation with Dr. Isabel, give our office a call. We are always happy to consult. And if you do need a surgery, we'll go through that whole list, that whole protocol that we have at Green City Dental to maximize your healing. Till next time, remember, your mouth matters.